really does not matter if you use a DSLR or if you use your phone for documentation if you don't know how to use your intraoral accessories correctly for documentation purposes. That is why I am making this video on how to use intraoral accessories for dental documentation. First of all, coming to the general criteria as to how to decide what to purchase in your intraoral accessories. Generally speaking, the cheek retractors have to be quite rigid as well as transparent. That would be ideal. Your contrastors or mirrors, they should be rigid, completely rigid, and they should not be flexible at all. Secondly, they should be contra-angled. If you're buying mirrors, make sure that they are front surface coated and not behind surface coated if you want to avoid the ghost shadow or the halo effect as we call it, because that appears as a blur in your images. We noticed that all the dentists had to hunt for all these accessories individually. That's why at dental photography school we thought that we should come up with a complete set of intraoral accessories. That prompted us to come up with something called as the magic box, which has all the intraoral accessories required by any dentist for any kind of documentation purposes. So let's see what do we have in the magic box. Inside the magic box we have transparent cheek retractors, one single unit V-shaped cheek retractor, a pair of C-shaped cheek retractors, and two sectional cheek retractors or quadrant retractors as we call it. After that we have stainless steel rigid heavy duty mirrors, which has a large size and a small size. Make sure that before you autoclave it, you peel the stickers and then autoclave it. We've put stickers on it so that it does not get scratches, and the moment you get, it's like absolutely scratch proof. So this is the full arch occlusal mirror. Then you get a sectional mirror or a sectional this is the perio part of it, and this is the quadrant part of the mirror. So most of the dentistry most of the documentation has to be done with this mirror. I use this mirror 90 to 95% of the times. And then we have the periodontal mirror. We also have the sectional contrasters, and then we have the full arch occlusal contrasters. We also have the grey card and a microfiber cloth. So this is the complete requirement of intraoral accessories that each and every dentist or the dental clinic must be having in their clinical practice. So I use this one set for one patient only. Before you want to autoclave, make sure that you put the intraoral accessories like mirrors and contrasters. You just wrap it in a soft facial wipe, that's the dry facial wipe, and then you pack it in the sterilization pouches, and then you put it for autoclaving. Make sure that you use steam type autoclaves. Don't use class B autoclave, because you don't want to remove the coating of the contrasters, or you don't want the cheek retractors to melt. Now let us have a look in detail as to when to use which intraoral accessory. For example, we use the V-shaped cheek retractor whenever we are documenting the molar relations or the canine relations of say suppose if I'm recording the right side, I use this on the right side, and I use the sectional contraster convex aspect on the contralateral side, so that in addition to good retraction, I also get a black background in front of the anteriors. That gives it quite an aesthetic result. Usually people who don't use this, you might be able to see that cheek retractors on the opposite side, or maybe you can see cheeks or mucosa on the opposite side, which is not quite pleasing. So I suggest that you use this V-shaped cheek retractor to record your molar relations, and on the contralateral side we use the sectional contraster. So you can use this for canine guidance as well. Next we have a pair of C-shaped cheek retractors, in which we'll be using this in maximum intercuspation shots. We'll be retracting both the sides. Make sure that the retraction is forwards and laterally. Lastly, we have something called as the sectional cheek retractors or the quadrant cheek retractors. So we have one cheek retractor for the first quadrant, the same one is for the third quadrant, and then we have one cheek retractor for the second quadrant. So this goes for the second quadrant, and it works for the fourth quadrant as well. Whenever you want to record full arch occlusal images, we use both the cheek retractors and retract only the upper lip along with the full arch occlusal mirror. So whenever you use mirrors, make sure that you use only the sectional cheek retractors and not the full C-shaped cheek retractors. If you want to record full occlusal images, try to use the bigger side of the mirror, which also has convexities on both the sides, which helps you get even more retraction. For pediatric patients, of course, you might have to use a smaller one, or patients which have limited mouth opening, you can use the small side. But for most of my documentation in my clinic, I use the quadrant mirrors, which I use it for 95% of the time. For example, if I want to record something on the second quadrant, say, so I'll retract only the second quadrant and I place the sectional mirror on the fourth quadrant. Because it's quadrangle, I can also retract, when I record the second quadrant, I put it on the third quadrant and push the third quadrant down, so that in addition to giving me a reflected image, it also helps me get some good retraction. That's why they have to be absolutely rigid. So I use this part of the mirror most of the times. Make sure that you use only the convex aspect of the mirrors. Concave aspect is used mostly in periodontal cases. So this is the perio side of the mirror. So this goes easily inside the mouth, and then this convexity can go inside the palate, and the periodontist can record the palatal flap, or if you want to record the lingual flap in the mandibular arch, it goes inside the floor and retracts the tongue, and then you can get the lingual flaps very nicely with this mirror. So I use the sectional mirror as well as the full arch occlusal mirror only with these sectional cheek retractors. Coming on to the aesthetic aspect, we give contrasters as well. So the sectional contrasters, like we've already seen, is used for the buccal images to record the molar and canine relations, but the narrower aspect, the narrower part is useful to record the lower anterior aesthetic cases. So it retracts the tongue as well as gives a beautiful contrast in front of your lower anteriors, an absolute must have for all the aesthetic dentists. Coming on to the full arch occlusal contraster, people who are into smile designing, which is digital, usually require the full arch to be recorded in front of a black background. That's when we use the bigger side of the contraster. However, for most of the routine aesthetic cases, I prefer to use the small side of the full arch occlusal contraster only. So this is absolutely beautiful. It does not give any glare. Just in case it gives you a glare, just tilt it by 1 degree and the glare must go off. Coming on to the absolute must have for all the dentists who do a lot of prosthesis in the clinic, that's the grey card. So this is the microfiber cloth. I forgot to mention that if there's a splatter of blood, saliva, or if you want to clean your accessories, don't scrub it with cotton, tissue or gauze piece. Just scrub it with this microfiber cloth and try to prevent scratches on your contrasters or the mirrors. An absolute must have for every intraoral accessory user. Coming back to the grey card, we have 3 cards inside this box. One is a white card, one is a black card, and one is a grey card, as you can see. So we use this during the shade making process or shade selection process, and after that we have to do a couple of post-processing steps, which the instructions of which are already given in the manual inside the magic box. An absolute must have if you want to remove any color casts that have appeared in your images, and if you want to achieve perfect communication with your lab. So make sure you have an 18% neutral grey card. And then you have a white card as well as a black card, which you can use to take pictures of your prosthesis. It's absolutely helpful. So it has a shining part and a matte part. Whenever you keep the prosthesis on this and you don't want a reflection of the prosthesis, we use the matte side. But if you like showing reflections of the prosthesis on the black surface, I suggest that you use the shining part of the black card. So that's with the grey card. So how to use the grey card, the instructions have already been given to you. How to autoclave the magic box, what precautions you should be taking while using the magic box are all there inside the instruction manual. So this is an overall outlook of the magic box. I hope and wish that all of you liked it, and if you wish to have one of these, you can log on to our website, that's www.dentalphotographyschool.in, or you can always contact our front desk on 9769-606-450 or 865522-5522. I'll be looking forward to help you if you have any questions with regards to intraoral accessories or even dental photography. For this video only so much. I'll be looking forward to see you soon. Thank you.